Anxiety is a feeling of tension, worried thoughts, or fear that can be mild or severe. It is your body's natural response to stress. But if your feelings are extreme, last for longer than 6 months, and are interfering with your life, you may have an anxiety disorder. 1. Anxiety disorders. These disorders are a group of mental disorders characterized by significant feelings of fear. These disorders may develop from a complex set of risk factors, including genetics, personality, and life events. Researchers are arguing that even these disorders run in families. Generalized anxiety disorder. It is a disorder in which a person is unexplainably and continually tense and uneasy. Panic disorder. It is a disorder in which a person experiences sudden episodes of intense dread. Phobias. It is a disorder in which a person feels irrationally and intensely afraid of a specific object or situation. Obsessive-compulsive disorder. It is a disorder in which a person is troubled by repetitive thoughts or actions. Post-traumatic stress disorder. It is a disorder in which a person has lingering memories, nightmares, and other symptoms for weeks after a severely threatening, uncontrollable event. 2. Symptoms of anxiety. People experience anxiety includes nightmares, panic attacks, thoughts, or memories that you can't control. Symptoms of this condition are the following: shortness of breath, sweating, loss of sexual drive, impotence, distress, fear, numbness, feeling nervous, insomnia, shame, feeling isolated, increased heart rate, feeling weak or tired, trouble concentrating, feeling restless or tense, having trouble sleeping, having difficulty controlling worry, having the urge to avoid things that trigger anxiety. 3. Causes of anxiety. It is caused by a combination of factors such as genetic and environmental factors. Changes in hormonal secretions also cause this condition. Social factors. Environmental or social factors are the following: financial problems, heart disease, diabetes, thyroid problems, such as hyperthyroidism, respiratory disorders, such as chronic obstructive pulmonary disease (COPD) and asthma, drug misuse or withdrawal, relationship problems, serious medical illness, emotional trauma such as the death of loved ones. Hormone cause anxiety. When hormone levels are too high or too low, this can influence neurotransmitters, resulting in problems such as increased anxiety. Hormones that increase social anxiety are sex hormones, stress hormones, and thyroid hormones. Sex hormones. Sex hormones such as testosterone and estrogen play a role in the anxiety you experience. Little testosterone with increased anxiety. Increased testosterone may help to reduce it, while low levels of the female sex hormones such as estrogen may also be linked to its symptoms. Anxiety is on the peak during times of hormonal change such as during puberty, at certain times of the menstrual cycle in women, and during menopause in women. Stress hormones. Stress hormones such as adrenaline and cortisol are released in situations when you are stressed. When you experience stress, cortisol increases, which slows your body's ability to make testosterone. Stress and sex hormones can also have a combined effect on anxiety. Excess levels of these hormones leave you feeling anxious and impact your body in various ways. The combined effect of increased cortisol and lowered testosterone may make you feel more anxious. Thyroid hormones. An overactive thyroid can create this disorder in the form of physical symptoms such as increased heart rate, palpitations, and increased sweating. If you live with a thyroid condition, this may make your social anxiety worse. 4. Prevention. Lifestyle changes can be an effective way to prevent anxiety. Some hormones can also help you to reduce this condition. Getting enough sleep, meditation, eating a balanced diet, staying active, avoiding alcohol, quitting smoking. 5. Complications. Having an anxiety disorder does more than make you worry. It can also lead to, or worsen, other mental and physical conditions, such as depression, which often occurs with an anxiety disorder, or other mental health disorders. Substance misuse, trouble sleeping, insomnia, digestive or bowel problems, headaches and chronic pain, social isolation, problems functioning at school or work, poor quality of life, suicide. 6. Hormones that may reduce social anxiety. There are actually some ways in which people prevent themselves from anxiety. Some hormones can also help to reduce this condition. Following are the list of such hormones that may reduce social anxiety. Estrogen is known to calm the fear response in women. As a female, you may have also noticed that your ability to feel calm and relaxed is better at certain points during your menstrual cycle. Oxytocin. You've probably heard of the love hormone, oxytocin. This is a hormone, acts as both a hormone and a brain neurotransmitter. It is known as the love hormone because it is released during contact with a loved one. Oxytocin is known to have an anti-anxiety effect and may help to relieve this disorder. Research shows that oxytocin promotes relaxation and trust, which makes it easier to manage social situations. Increase oxytocin by doing the following. Give a gift. Cuddling with a loved one. Use social media. Mediate. Spend time with a friend. Share a meal. Foods that increase oxytocin secretion are figs, avocados, watermelon, spinach, and green tea. 7. Testosterone. Little testosterone may increase social anxiety. Increased testosterone may help to reduce it. Testosterone as a steroid hormone has been shown to reduce socially fearful and avoidant behavior in general. Men have half the reported rate of anxiety disorders as women. This is due to the role of testosterone in levels of anxiety. Increase testosterone by doing the following. Eating a balanced diet that contains protein, fat and carbohydrates. Getting regular exercise. Minimize stress and cortisol levels. Get enough high-quality sleep. Take vitamin and mineral supplements. Food that increases testosterone secretions is tuna, low-fat milk egg yolks, fortified cereals, oysters, shellfish, beef, beans. 8. Treatment. For some people, medical treatment isn't necessary. Lifestyle changes may be enough to cope with the symptoms. In moderate or severe cases, however, treatment can help you overcome the symptoms. Treatment is of two types. 1. Psychotherapy. Psychotherapy is a type of counseling that addresses the emotional response to mental illness. A mental health specialist helps you by talking about how to understand and deal with your disorder. Cognitive behavioral therapy (CBT) is the most widely used therapy for anxiety disorders. Research has shown it to be effective in the treatment of panic disorders, social and generalized anxiety disorder, and among many other conditions. 2. Medication. Medications typically used to treat anxiety include antidepressants and sedatives. Benzodiazepines such as Valium, Xanax, Klonopin, and Ativan are sometimes used to treat anxiety for a short-term period.